Welcome to New Hampshire's Business. I'm Fred Coker. There's a continuing dilemma across New England and here in New Hampshire. It's nursing homes, often with fewer available beds and fewer staff, despite the New England states reportedly having the oldest populations in the U.S. Now, data from the Federal Reserve Bank of Boston shows the number of nursing homes in the U.S. dropped between 2010 and 2023. Across New England during that period of time, the number of nursing homes is down 15%, while in New Hampshire, the number of nursing homes is down in that period of time about 9%. Now, nursing home employment has fallen in each New England state, ranging from 7% drop in New Hampshire to a 19% drop in Rhode Island, even while total employment across all business sectors is rebounding. Now, the older population, take a look at this. In each state, the share of population 75 and older is greater than age 75 and older of U.S. population. The number of working age residents in New England is declining relative to the number of older residents. That's from the Federal Reserve Bank of Boston. So with us to give us direct testimony on these developments are two nursing home administrators, Craig Labor, administrator of the Grafton County Nursing Home, and Ray Bauer, administrator of the Strafford County Nursing Home. Welcome to you both.
Thank you.
You're in the business of providing a nursing home bed to any New Hampshire resident, irrespective of finances and before Medicaid kicks in. My information is that there are fewer beds than the demand that you're seeing. Craig, what about that?
Yeah, so the idea I think right now is that with the way that our staffing levels are right now, we're only trying to staff to what we can safely provide care for, and that, you know, at times creates that backlog. But
so you have a backlog.
We do.
Yeah. And Ray.
And it's the same. It's the same for us. We actually have one unit that was in operation, and we've actually closed that unit as a result of lack of staffing.
And you go to backlog too.
And that creates a bigger backlog. We've always had a backlog, but that creates a bigger backlog when you have a unit.
And part of that problem is staffing, as I know you will say. The Centers for Medicare and Medicaid Services recently, as you well know, set a new rule on staffing of nursing homes that require a nurse to be on duty 24 hours a day, 7 days a week. Are you going to be able to staff up to that rule?
We will be able to staff up to that rule as in terms of having an RN available, but that's I think we're in a unique situation as compared to a lot of nursing homes that won't be able to have that RN 24/7.
What about Grafton?
At Grafton County, we will not be able to meet that rule. And the biggest issue for us right now is that RN requirement, the registered nurse requirement for 24 hours a day.
And assistant nurses as well, I guess.
Correct.
Yeah, and you just don't have the nursing staff out there then.
Well, we don't. And the thing though is that there is a requirement for the hours per resident day, which we do meet, and a lot of the county nursing homes are meeting that specific number.
Yeah.
But the trouble that CMS has caused for nursing homes is that they're not including licensed practical nurses into that equation.
Okay.
And if they included licensed practical nurses, then every facility would be meeting that expectation going forward. Now,
here's a New Hampshire Medicaid enrollment graphic. Daily rate $388.21, monthly rate $11,809.35. That just gives people an idea of what the rates are out there. Are those pretty close to what you have?
Those would be the average private pay rate.
Private pay, right.
Right. The Medicaid rate is two-thirds that at best.
Okay. I've been told by some guests on previous programs here that the state Medicaid program is slow in paying the cost associated with your Medicaid patients. Is that happening?
Absolutely. Just this year alone, we're $400,000 slow in payment, and some of our back payments go back last year in the area of $600,000 or $700,000.
Correct.
And of our cases that are still pending Medicaid status, we have 11 of them that have been over 8 months, and our total right now is $434,000 in back payments.
Wow. Well, I want to thank both of you. sometimes the decision to go into long-term care or nursing care is countered by the fact that people want to age at home, and I know that's another factor. But my thanks to Craig Labor, administrator at the Grafton County Nursing Home, and Ray Bauer, administrator of the Stratford County Nursing Home. And if you missed part of this briefing on New Hampshire's nursing homes, you can go to WMUR.com. It will be posted there all this week.